directions right here. I think this is the main one here, right?
I can't tell.
Okay. And then we take this tool here, I call it the can opener. When patients aren't around, I call it Jack the Ripper.
like
It's
Jack
good at
the
ripping up the adhesions, and I can feel where it is. Now, Kathy used to get really deep soft tissue massage, but with your thumb, no matter how deep you press, you can't feel it. And I could feel it vibrating through the stainless steel metal, like a stethoscope, so I know where the scar tissue and calcifications are, and I know how much pressure I need, A, she can tolerate, and B, to break it all up. So,
And it feels really good.
exactly.
I mean, like healing kind
And
of
you think it looks like some type of Chinese torture, but it's actually very good.
Oh my gosh, it's like fabulous.
So when we get the skin, and when it's nice and red, we know we're getting the good blood circulation in there. And after that, we're going to get the high-powered laser. And what the laser will do, it will bring in photonic energy to bring ATP and oxygen to the tissue, because the tissue can't function normally without oxygen. And it'll bring in more heat for circulation, and it'll increase the healing factor by a factor of 3, because it decreases inflammation as well, because it's going to cause lymphatic drainage, and we're going to get fresh blood in and the waste products out. Okay? So, where's that? Here we go. Here. So we're going to get the class 4 laser, and we're going to put it on, we got 9 watts, pulsed, because the skin is very thin here, so we don't need a whole lot of wattage of this. Let's make sure. Okay. Like, tell me if it gets too hot, alright? So really combining the two treatments, we're getting probably 3 to 6 times faster healing than other methods that she's tried, and she's tried everything the past 20 years, and soft tissue work on it, and there's, you can try injections in the feet like prolotherapy or steroid injections, but A, they're very painful to do in the feet, and B, if you inject the wrong nerve, it can cause more pain than it's worth. Pain medications are just going to mask anything, because this is it's a physical, it's a structural disorder, and you need a physical or structural treatment for it, and that's what the Graston tool does. It mechanically breaks up the scar tissue, and then we have our photo light therapy, which increases the healing factor. So you work a little there, you go to the worst foot there, and you can see that she's starting to get a little hammer toe here, because it's been chronically compressed here. So we can prevent it from getting worse by maybe getting a toe spacer, or maybe fitting her with an orthotic, which will put a metatarsal pad, and that will raise up these metatarsals, see, like that, to spread them out. So there are definitely things we can do to stop the progression and get her back where she can run pain-free, which she already did in 1 treatment, which is a miracle in my book and hers. All right. Thanks for watching Laser TV.